get right into it. Let's turn this over to Nicole Augustine. Welcome, Nicole.
Thank you so much, Steve. Hello, everyone. I hope you all are doing well today. I did place in the chat for those of you who didn't get to see. I always welcome people the opportunity to turn your cameras on so that I can see your face, but also that we can see each other. I will just kind of give you all a disclaimer that this particular session is interactive. We are planning to have a breakout room. So go ahead and mentally freak out right now. You'll have at least 30 minutes of time before we get to there. But do know we are going to do a breakout room because for this particular one, I do want folks to have conversations about the ways in which you are seeing ACEs show up in your communities. So just be prepared for that. We've changed pretty dramatically since we used to do trainings like 95% in person. The virtual world that kind of came into existence because of the pandemic has been wonderful, but it's also created some interesting dynamics in the training world that didn't used to exist. Because there used to be a time you met in person, you didn't have an option not to have your face seen, right? The beautiful part about Zoom and spaces like that is we can be present and not present at the same time. So just giving you all a heads up, there will be a breakout conversation that happens so folks can get mentally prepared for that and to have a bit of discussion as a part of our conversation today. So as we get started, this is a part 2. Let me do one more thing before I share screen. So I'm curious, anybody who was here yesterday, can we test out the thumbs up reaction? If I can get a thumbs up reaction for anybody who was here yesterday, that way I can just get a sense of how many returning folks we have. Look at those thumbs up. Fabulous. Wonderful. Okay, good. This is great. Thank you all for that. Okay. It's always nice to just get a sense of who are my returning folks in the room. So for those of you who this is your first time, we are recording this series. So once Steve post everything, I encourage you to check out the session you missed yesterday. But my name is Nicole Augustine. I am a huge advocate of public health and prevention. My background in undergrad, I studied sociology. So I've always been interested and fascinated by how people think, how culture and social influences impact health, wellness, and how we think and exist in the world. So I'm very excited about this series and to be talking with you all this week about equity in action. We're going to focus today on ACEs specifically as a topic that I think is of great relevance and importance to us in prevention. So for those of you who were here, you know that I use Mentimeter. So I want to give us an opportunity to go ahead and get into Mentimeter. I decided to use a different way to show this today to give people a test. So 2 things, you can bring up the camera on your phone. It's going to bring up Mentimeter and drop you into the presentation. The other option is you can open up a browser on your computer, type in menti.com. It's going to ask you for a code. You simply place that code in. Now, for this one is kind of fun. So you are going to use the emojis section of your phone to say what might be a dream vacation of yours. And what's cool is they'll show up on the screen here as people start to find their emoji and plug in for themselves a dream vacation. So I just wanted to do this as a test to make sure people's Menti is working properly as we dive into the content. Oh, look at the emojis popping up. We got a beach. We got a palm tree. We got folks using words, which is totally fine. This is creating a word cloud or emoji cloud, depending on what you choose. Okay. Great. Okay, good. I wanted to make sure the Menti's working. So we'll be using this throughout our time together to really help with the interaction. Oh, we got the flag in there. Great. Oh, an African safari. Wonderful. Okay, so everybody knows how to use Menti now, which is fabulous. And I love these word clouds. They just make it a fun way to see what people say. Okay. Great. Awesome. Thank you all. I appreciate that. So you only have to do that once, right? In the future, when a Mentimeter slide comes up, it's already there loaded for you. It will move and progress forward. All right. Okay, so let us get, oh, I looked at some of the more of the emojis. Wonderful. Thank you all for participating in this. These kind of things are fun to do. All right, so let's get started on setting our intention. The very first thing we're going to do is for everyone to grab a piece of paper, and we are going to do our initial activity of setting our intention. So grab the piece of paper, just a regular piece of paper. You're going to split it into 4 quadrants, okay? Just like that. And what I am going to do is I have 4 questions I'm going to ask you all. And this is what we'll do to kind of get ourselves ready and into our conversation. The first thing is the thing I've noticed and recognized as a part of our change in this world is many of us go to back meetings. So it is very possible you got done with a meeting, if you're in Central Time, at 11:59 before coming into this room. So the first thing I want you to do is in that cross section, the middle, we're going to draw the tightest little spiral there in the middle of the piece of paper. That's why we're seeing spirals here. So I am simply going to set a timer for just 45 seconds of time. That's all, just a short moment. And you'll draw this tightest spiral there where those 2 lines intersect. And as you do this, be sure to breathe. I know I tend to notice that I'm holding my breath when I'm doing this activity. So just take a few deep breaths as you do this to clear your mind of all the emails you may be thinking about, the meeting you had before coming here, the meeting you've got afterwards. Just take a moment to release all those things from the space so that you have an opportunity to be fully present in our hour together. Okay, our first question in the top left quadrant. When you think about ACEs, what comes to mind? When you think about ACEs, what comes to mind? Okay. Our second question in the top right box. What fears do you have about prevention focusing on trauma? What fears do you have about prevention focusing on trauma? Okay. All right, our third question, this is going to be in the bottom left box. What do you think is our biggest potential for change? What do you think is our biggest potential for change? Okay, and then our last question here is just to find out, what are you hoping to get from today's session? What made you log in today? What are you hoping to get from today's session? Okay. All right. Okay. So thank you for just taking a moment to get ourselves set and centered into the work ahead. I really have two main objectives in our time. I want to spend a little bit of time thinking about and explaining how our environments really cultivate our health and wellness. I think that sets the stage for defining ACEs, understanding what it is, and really kind of having a bit of a brainstorm on what are the ways ACEs are showing up in the communities we serve? And how are people already thinking about and identifying the ways of addressing ACEs and looking at resilience? So,
Nicole,
yes.
someone's put in the chat, Glenda would like the Mentimeter code. You'll share that again before you're
Oh, yes, I totally will. And you know what? I'll go ahead and put it on the slide too, up at the top there. That way it shows up. Okay. Thank you. And I'll show it again too, but thank you for saying that. Wonderful. All right. So let's get started by thinking about this connection between the environment, ACEs, and equity. And I found this really great graphic, you all, that I think says a lot. And so I'm going to show you the whole graphic, and then we're going to break it down and walk through it as a group. The first thing is the top of the graphic, which just simply says our environments cultivate our communities and our communities nurture our health. And what I encourage you to do, even just for a moment here, is to stop and truly think about the way in which this is true for you. As you imagine your neighborhood, as you imagine the resources that you have access to, really consider how those resources and that access helps to cultivate and nurture your health and your wellness. And what we notice is there are a few types of experiences that a community may have. You have the first type of community, which has a high level of inequities, high level of stress. Okay. As a result, you'll see low access to assets. And typically what this graphic is saying is as you really begin to look down into the soil, you'll see the root causes of what is creating the health outcomes. As we talked about yesterday, it's like what's creating the disparities. So when you look at the root, you'll see things like substandard living conditions, challenges around unemployment and poverty and racism, discrimination, right? All these things in the soil that really impact the ability of a community to thrive and flourish. And so, what ends up happening, what I think about in prevention, our practice, we have a tendency to look up in the branches of the trees and we respond to the data that we get on how much someone is drinking, stress or violence, some of those things that our prevention practice has a tendency to address. And the idea here is beginning to think about if we only place our strategies in the branches, what are we missing when we do that? You know? So the other side shows what happens when you have a community that has higher assets and lower inequalities happening. As a result, the soil that this tree grows in looks completely different. Okay. You have opportunities for employment, quality education, housing. This should be ringing the bell of the social determinants of health. Okay. When this is happening, what we learn is that a community is able to thrive despite. It doesn't mean a community is without disease or without illness or without stress. It just means the community has the resources necessary to blossom and flourish despite those things existing. And so, what can be interesting is when we look at these two trees side by side, both environments experience depression, malnutrition, smoking, okay, violence. However, the tree on the right is able to flourish and have leaves and have growth despite those things. And that's the story of resilience. What I encourage you all to be thinking about is, what does the landscape of your community look like? How many zip codes look like the tree on the right? And how many zip codes look like the tree on the left? And really thinking and considering that when we're talking about our prevention work, because that environment sets the stage for the overall wellness of the people in that community. So our next Mentimeter here, I'm going to put the vote code up again. I want to get a sense from you for how you're collecting data right now. To what degree do you feel you collect data on the leaves, the trunk, and the root? And if you go back to your Menti, you'll see that the slide bar is there for you to do your vote for just to what degree you're collecting data. And it'd be interesting to see where people kind of pan out here. Okay, thank you. We got some votes coming in. All right. I always like this graphic too. It's interesting to see here. Okay, okay. Thank you all for plugging in your votes. And you know, this is pretty common, you all. Most of us collect data on the leaf section. These are the symptoms, honestly, because it's the easiest level for us to collect data on. It gets more challenging to collect data in the other spaces. However, when we think about root causes and what creates inequities in communities, we've got to start digging a little bit deeper to uncover these things. So wonderful. Okay, thank you all for that. This is pretty typical spread of what is seen. My hope is that as we have more conversations around this, that we'll get to the place where I can put a slide up like this and the trunk and the root data will be much higher in the future. Okay, so let's dig into ACEs here. Now, I'm sure many of you have heard of adverse childhood experiences before. It is not a new topic, actually. It's been around since the 90s. Fortunately, there have been some pretty big advances in ACEs since it first came out. And the original ACEs study got some criticism because it was very individual focused. There is an organization called PACES, which is really thinking about the other part of the ACE experience, which are, you know, the positive interactions that a young person could have and should have. I share them because they have put together a really great graphic, you all, that I think is even more comprehensive. And it is called, I'm just going to put the link in the chat here too for you all. This particular graphic is the 3 realms of ACEs. And the idea is that the very first ACE study focused just here in the individual household space. And so, you know, as we've learned more about people and society, we realized that this one level of ACEs wasn't sufficient. And so I use this model because I think it's way more comprehensive to all the ways things interact. So the 3 realms includes the adverse child, but we also look at the community and the environment. Okay, so the second level is the community level. This is recognizing that people don't live in a bubble. So we have adverse community experiences along with adverse childhood experiences. Okay, the community experiences, just like that first tree, you all, are looking at what's in the physical environment. What's the context around historical trauma, racism, poverty, all these things that significantly impact a person's overall health outcomes. Now, what I really appreciate about this particular concept of ACEs is they've included this third dimension, which is the environment, right? Because again, we don't live in a bubble. And this graphic ended up getting updated after the pandemic. So now they have pandemic on there. The first versions didn't. And I really appreciated this particular group always kind of staying ahead of the game when it comes to this. But if you think about it, we also have environmental impacts that can create trauma. We've experienced it many times in this country, along with some communities experiencing even more trauma or lack of resources when they experience a natural disaster. We have plenty of examples of that, unfortunately. And the idea is that these three realms come together to really holistically create the accumulative experience of trauma. Okay. And looking at how that negatively impacts health outcomes, risk of substance use disorders, and so many other things. So I'm curious how many of you, and you all can do this by thumbs up, how many of you have heard of Nadine Burke's? Well, Dr. Nadine Burke Harris. How many of you heard of her? See if I got a few thumbs up in the room. Okay, a couple thumbs up. If you haven't, great, thank you. There's a few people who have. If you haven't, and you have an interest in ACEs, I really encourage you to check this out. As we've mentioned, there's a digital guide for this. The link to her TED Talk is in there for you all to look in more detail. I want to show this particular video clip that she actually just released here recently. She is the California Surgeon General, and she's the champion of ACEs and has been for a few decades now. She's a pediatrician, and she really has given a lot of critical thought to why ACEs is important and how we should be thinking about it. So I want to share this video with you, and this is my preamble. After we watch this video, you all, we are going to do a short breakout room, because what I want you all to be thinking about is what she talks about and what you're seeing in your communities. What ways are you seeing ACEs? And are you, in the communities you're serving, the organizations you're with, are you all having conversations about how we can look at ACEs, how we can look at resilience as a cornerstone to the work that we do in prevention? So let's take a listen to what she has to share with us.
The term ACEs stands for Adverse Childhood Experiences. And these are stressful or traumatic experiences that happen in childhood that can increase the risk for significant health, mental health, and behavioral consequences later in life. They really come from a big landmark research study that was done by the CDC and Kaiser now more than 20 years ago, in which they asked adults about their history of 10 categories of adverse childhood experiences. And these include physical, emotional, or sexual abuse, physical or emotional neglect, or growing up in a household where a parent experienced mental illness, substance dependence, incarceration, where there was parental separation or divorce, or intimate partner violence. What they found was, number one, ACEs are super common. And number two, that there's this really significant effect. So there's a direct, what we call a dose-response relationship between adverse childhood experiences and some of the most significant and serious health conditions that are facing Americans today. 2/3 of individuals had experienced at least one, and 1 in 8 folks had experienced 4 or more. When we talk about how many of us have experienced ACEs, what we see is that ACEs impact every community, every demographic group, but it impacts our vulnerable communities in a disproportionate level. The big surprise about the ACE study was that for someone with 4 more ACEs, their risk of heart disease was double, right? For stroke and cancer and liver disease and diabetes, even autoimmune disease. And a lot of these things are things that we didn't kind of traditionally or intuitively associate with childhood trauma. But now we can use this science to understand actually what happens in our brains and bodies when we're exposed to trauma or adversity, and especially in childhood. the term, the toxic stress response, actually refers to the prolonged activation of our body's stress response, the release of all those stress hormones like adrenaline and cortisol and all of those things that go along with our stress response. And then also the ways in which that affects our bodies. Children are especially vulnerable to this repeated activation of the stress response because their brains and bodies are just developing. So high doses of adversity in children actually changes the way their brains develop. It changes the way their hormonal systems develop, their immune system develops, and even the way their DNA is read and transcribed. And those long-term changes are what we refer to as the toxic stress response. One of the things that's really challenging about ACEs is that they tend to repeat in families, generation after generation. And I will say this as someone who has experienced my fair share of ACEs. Understanding how that might be impacting me and being able to recognize that, for me, is really the key for being able to do things differently. When we understand what happens in our bodies with the toxic stress response, and we understand that it's that prolonged activation of our stress response, then step one is really understanding what are the things that help to regulate our stress response. And immediately at that point, we begin decreasing the harm that happened as a result of our past experiences. So things like mindfulness, right? Meditation, spending time in nature, mental health interventions, regular exercise, nutritional strategies, and my favorite, healthy relationships. All of these things are really scientifically demonstrated to help to regulate the biological stress response, and they improve our outcomes for those of us who have experienced ACEs. These nurturing relationships, they feel good, which is good, of course, but they literally change our biology. When we have safe, stable, and nurturing relationships in our lives, it improves our neurologic functioning, it improves our hormonal regulation, it improves our immune functioning, and these social supports are critical part of healing. If we all understand our role in being a source of buffering care to a young person in need, that is truly transformative. ACEs Aware is a first-in-the-nation effort to train our healthcare providers how to screen for adverse childhood experiences and how to respond in an evidence-based, trauma-informed way that helps to improve outcomes for children and adults. ACEs are not destiny. Even if someone has experienced significant ACEs, it doesn't mean that they are absolutely going to have these negative outcomes. Recognizing our ACEs requires us to recognize our vulnerability. And that can be really scary. But it also is the place where we get a chance to ask for what we need. I deeply believe that we can cut ACEs and toxic stress by half in one generation.
Okay. So first, I just want to open up Menti for a moment as you all kind of take in everything that Dr. Harris just shared. I have so much respect for all the things she talks about. I know I wrote multiple notes myself. I'm going to be curious, what are some things that stood out to you as you all think and gather your thoughts? We're going to do just a 10-minute breakout room, but I'll pause a minute here for folks to share any thoughts in the Mentimeter. So what I find profound and interesting, you all, about the conversation of ACEs is I keep thinking about all the ways prevention can interact and how it shows up. So what's interesting is she talked about how the impact of early childhood trauma affects the developing brain. And what I thought about for our work is we also know by brain science that early substance use impacts the developing brain too. So I keep thinking about the accumulative impact of early substance use plus someone experiencing ACEs, right? We talk about impacts on long-term health outcomes. We know the trauma alone creates challenges, and then when you add early substance use onto that too, I'm like, wow, prevention, this is our opportunity to change the trajectory of some people's health outcomes. So that was an awesome moment to kind of think about that I think she brought to light there. The other thing I thought was so interesting is she talked about how when we understand ACEs, we understand some of the strategies we should be helping people with is regulating our stress response. And again, that was a moment that I thought about prevention. I thought about our prevention curriculums, our strategies, right? The ways in which we bring resources and tools to communities to respond healthily towards stress. And hopefully, if we're working on the environment, right, we are either, leaning on our coalition work or advocacy work to help reduce the risk factors and the stress that's happening in the community level. I want to thank the folks who are using Menti to share some of their thoughts here. I agree, ACEs are not your destiny. That is a sentence that really hit home for me because like she said, I'm someone too who has my fair share of ACEs. What is interesting when you think just generally about the helping profession, a lot of times we as a group of people will have ACEs. It becomes sometimes our youth child experience is a part of what motivated and inspired us to be in the helping profession in the first place. So I know for me, I am evidence of ACEs not being my destiny, of which I'm so grateful that is a factive statement. So thank you all for your thoughts here of what you've shared. Again, if you haven't done your own research a lot into ACEs, or if your organization hasn't really started talking about this more, I encourage you to do some Googling, bring this to a staff meeting, a training, because I do believe, I love the tagline, it's screen, respond, and heal around ACEs. And I've seen some school districts looking at how to embed ACEs screenings into their work so that they can have an understanding of the level of ACEs in their school system so that they can respond and create a more healthy environment. So I do think this is kind of the wave of our future. So, Steve, if you will help me out, what I'd love to do is to send you all into a breakout room. We're only going to do a 10-minute discussion. And actually, maybe, Steve, if you could make it 8 minutes for me, since I'm looking at the time, we got 20 minutes left. And what I'd love for you to do is to answer 2 questions. How have you seen ACEs showing up in your community? What are you talking about? And then I'd love for you all to begin to brainstorm. What do you think are some strategies for healing our community ACEs? What could your agency be doing to address them? So we're going to do the breakout rooms totally random. I'm sure you'll get to meet new people. We'll do an 8-minute breakout room. We'll come back, have a discussion, and close out for the day. Okay?
We're ready. Here we go.
All right, we're ready. I'll stop sharing. I'll pause the recording here. Okay, so welcome back from your conversations. Hopefully you all had some good talks. Hopefully we didn't lose too many people. I always know breakout rooms scare folks. So some people rather leave a webinar than do a breakout room. So hopefully you all had some good conversations. We do have about 10 minutes left here, so I wanted to open up the space for any other additional thoughts that folks wanted to share now that you all had a little bit of opportunity to talk. Was there anything profound that folks heard in their room that they wanted to share? I'd love to open up the room here and really the mic for folks to share their thoughts in our time together. Let me see if anyone has anything they want to share in the larger group space. Wonderful. Thank you, Molly. Feel free to unmute and chat with us.
Hi, so I'm Molly Rains, and I'm a community mobilizer for Montgomery County Wellness Coalition, and we are located in the very south corner of Southeast Kansas. In my breakout room, we just shared a lot of experience with the three of us working in a rural setting. And my specific questions that I had is we see a lot of ACEs in our area, and I didn't get to talk about it in the breakout room, but I feel like it's something to share. But I recently saw on Facebook, out of all places, about testing scores, for example. Comparing testing scores, student by student, but how would testing scores look doing acing scores next to it, having those adverse childhood experiences? How would that look from student to student? So that's just something I wanted to share and keep in mind. But for me personally, and like I said, I'm just speaking on behalf of Southeast Kansas. The biggest thing for us is we have a lot of resources and we have a lot of people stepping up to the table, wanting to do different things. But at the same time, I think there's a lot of overlap. And so it's almost like, sometimes if there's too much overlap, there's not anything being accomplished. So how do we break that barrier for all of us to be able to participate together and do all these different things, but not have that overlap? So we're still trying to get stuff done, if that makes sense. So like I said, I'm just speaking on behalf of my experiences, but it was really nice to have those same experiences and shared communication with those who are also in rural Midwest.
Wow. Thank you for sharing all of that, Molly. I really appreciate it. It was quite a serendipitous experience, I imagine, to be in a room and it was random, that you all had a shared experience also being rural. I was fascinated by this kind of comparison of ACE scores and testing scores. I mean, I think that would be really interesting as a way of, really truly assessing a particular community to see where those correlations would be. I wouldn't be surprised if there's a correlation between those. In that higher ACE scores might also see lower testing scores. So that might be something very interesting to look at and see what the community finds from that. So thank you for sharing that. I was just noticing in the chat the good behavior game being mentioned as a resource. That is a resource that I'm familiar with. Again, that for those who don't know, please, thank you for sharing it in the chat, Julie. It's a wonderful resource for really looking at how we change the physical classroom environment, how teachers respond to disciplinary challenges with students. So that's a environmental strategy type of situation, which usually requires the whole school to be a part of it. And definitely looking at the more trauma-informed way of addressing classroom behavior specifically. So yeah, any other thoughts folks wanted to share in the room, in the space while we're here together, thinking about ACEs, how ACEs has been showing up in the community you serve, the way in which you see it, and any thoughts and challenges there?
Hi. So my group, we were talking, Julie and I were talking. So I work on Long Island in New York. So it's pretty suburban.
Okay.
But Long Island is one of the most racially segregated areas of the country. A lot of redlining historically, occurred on Long Island. So just starting off from there, from the environment, from the ground up, you could really see how resources are dispersed, not equitably. And yeah, we also started talking about, I thought it would be nice to have something like the ACEs Aware initiative, but like for schools and administration in schools. I just think that that would be such an impactful, like, important piece to put you know, students' experiences into context of what's really going on at home. Because I've seen a lot of issues. I see a lot of students that are needing IEPs and things like that. But a lot of times it's behavioral, it's things happening in the home, in the community. So yeah, that was something that came up in our conversation.
Yes. Thank you so much for sharing all that. And I really appreciate you being here on the webinar, despite it not being your region, because the concepts of ACEs really impact all communities. I appreciate you also just sharing the context of Rhode Island, the historical trauma, that history piece, which impacts so many communities. What you mentioned about redlining, I think there probably isn't a community in the US that didn't have that happening, unfortunately, and just considering the domino impact of that over time. What I did place in the chat, the website for the acesaware.org. And so is it Risa? Okay, so to Risa's point, this particular strategy does look at healthcare providers. Dr. Harris is a pediatrician, and so most of her work is focused on doctors, nurses, that world in that space. What I say is that the model is a model, essentially. I think we can learn from what she has pioneered in the healthcare space, and to Risa's point, apply it to schools. I have seen a few school districts really looking at how to embed concepts of ACEs and understanding ACEs into their school registration process, bringing in new students, and really looking at that data to have a better awareness of where students are coming from, what are the community and environmental ACEs that their students are experiencing, and then looking at how schools can collaborate with prevention agencies, with coalitions, with community partners to really begin to address the community environmental struggles that are happening. So I, am happy to even hear folks thinking about that part too, which is wonderful. I have not yet found a version of this initiative in our space of SUD prevention or specifically public health yet. So I say that out loud here because if someone does know a resource or, something that's happening, please do drop it in the chat or send it to Steve or myself personally. We want to make sure we're able to find new resources for folks on this, because I do think conversations around ACEs are becoming more and more important as we really look at the impact of trauma on brain development. And if we're really going to be thinking about how do we improve health outcomes, because one of the outcomes of ACEs, you all, is risk of substance use disorders. That's the world we care about. And if trauma is impacting the way young people's brains develop and early substance use does it too, to me, that feels like a double whammy, unfortunately, to human potential. So I'm like, how do we think about ACEs? How do we really look at how to expand the work and create changes to address the challenges that so many communities are experiencing? Steve, I am seeing the time here. I've talked a lot. I want to be able to give an opportunity for you to drop the evaluation into the space for folks to give us feedback there on the session today. We truly appreciate you all coming. Thank you, Glenda, for mentioning Dr. DeGrew. Yes, I probably know what you're referring to there with her work. So if folks have not heard of Dr. Joy DeGruy, do look her up. She focuses a lot on trauma and specific trauma that's related to the impact of slavery historically, how it's, that trauma has been impacted on people of color in the long term. So I encourage y'all to check that out too. Please do provide us feedback on the session. We like to know how it went and your experience. My hope is that you all will come back tomorrow and bring a friend. Thank you all who are here today, who returned from yesterday. Hopefully today was still good and you'll come back and spend lunch with me and Steve tomorrow. We'd love to have you back.
Thank you, Nicole. Thank you, everyone, for being here today.
Thank you so much.
Yes. Please take a moment to fill out our evaluation, if you would.
Ooh. Glenda, you still on? I wonder if Glenda's still around. Oh, yes.
I am.
Resma, is that who did my grandmother's hands?
Yes. But do you know about Dr. Stevenson's work at University of Pennsylvania? So Dr. Stevenson is the brother of Brian Stevenson, who does the death row stuff. He's at the
Hello, Glenda?
University of Pennsylvania for right now. I can't remember his children of color to prepare them for racism.
Okay. Thank you. I wrote down those names, so I will check those out. Thank you.
Thank you. Thank you for another good session. That's what I was writing in the chat. Now I don't have to write it. Bye.
Awesome. Thank you, Glenda.
Thank you, Glenda.
Okay. Bye. All right, Steve. So I